everyone. Welcome to Ask Dr. Bob. This is where you ask me, Dr. Bob Gebe, Chief Scientific and Medical Officer here at the American Diabetes Association, your questions about diabetes. And this is a little bit of a special episode because it is my last episode here at the American Diabetes Association. I'll be leaving the organization, but I'll be continuing Ask Dr. Bob, so stay tuned at the end to hear all about the plans. Each month, as the regular viewers know, we pick a theme, and I thought this time for this special one, the American Diabetes Association has a Center for Information, and it is a place where people all around the country either call in to 1-800-DIABETES, which if you ever have a question, you can call in, or emailing at askada@diabetes.org. That's askada@diabetes.org. And so we get all sorts of questions on all sorts of things, and I picked a few of those questions to be our theme today. Again, connect with me on LinkedIn because I provide lots of other information on Ask Dr. Bob, but all sorts of useful things and tips for diabetes. So let's get started with the questions that we received. So here is one, and the person says, my son was recently diagnosed with juvenile diabetes and prescribed Lantus. Let me just stop there. So we don't tend to use the word juvenile diabetes because it can mean many different things. And in fact, you may be familiar, there's an organization called the Juvenile Diabetes Research Foundation. They changed their name to Breakthrough Type 1 because juvenile diabetes is not really a thing. You can have either type of diabetes, type 1 or type 2, as a child. So anyhow, let's get back to this question. So my son was recently diagnosed with juvenile diabetes and prescribed Lantus. That's a long-acting insulin. And testing his blood sugars at home and they've been too low. And I've decided to stop his insulin, and his blood sugars are great. Was he possibly misdiagnosed? Well, so that's a good question, and it brings up something called a honeymoon. So I'll explain what that is in a moment. So first of all, I can't, without knowing all about an individual, I can't provide medical advice for this particular person, but I can talk about the general idea. And so what happens when someone develops type 1 diabetes? Let's go back to that. What is type 1 diabetes? It's an autoimmune disease that destroys the cells that make insulin. And over time, people make no insulin at all. And the only treatment then is insulin replacement therapy. So early on, somebody could have lost a lot of ability to make insulin, but not complete ability. And well, they have chronically high blood glucose levels, and that can, in and of itself, damage the insulin producing cells so that they don't make as much insulin as they normally would. And during that time, somebody can have very high blood glucose levels. They show up to an emergency room. They're diagnosed with type 1 diabetes. They get started on insulin. And a very common phenomenon is something called the honeymoon. And what do we mean by the honeymoon is exactly what this person is noticing with their son, is that someone gets started on insulin, blood glucose levels come down, and now those insulin-producing cells that are still there to some degree, but were damaged by the really high glucose for a long time, wake up and start making insulin. And for some period of time, the reason they call it a honeymoon is that they can go off insulin. So that's pretty common for many people when they're first diagnosed with type 1, that they can have a honeymoon. Unfortunately, they typically will ultimately require insulin again. And so that honeymoon can be weeks, months, sometimes a year or two, as long as that. and ultimately then their blood glucoses rise and they'll need insulin again. So it doesn't mean that they were misdiagnosed. It might be that they are actually in a honeymoon. Okay, that was the first question. I know a complicated answer, but some important points to think about what type 1 is and what a honeymoon is. So here's the next call that came to our Center for Information. I don't know why I have diabetes. I'm not overweight. I eat healthy. I'm actually an active person. There's no family history of diabetes. How did I get it? Well, this is also a common question that we hear, and there could be a few reasons. So first, they mentioned a lot of the reasons why people develop type 2 diabetes. If they are overweight, they're at higher risk. Unhealthy eating can be part of it. Being less active can be part of it. Having a family history of diabetes. All of those can be causes for type 2 diabetes. But there are some people that don't have any of those reasons and still develop type 2. And why? Well, we don't totally understand. Sadly, would sometimes tell my patients, unfortunately, you're unlucky. You don't have risk factors, but that's not the only reason why people develop type 2 diabetes. And then there's what we were just talking about, type 1 diabetes, that none of those risk factors are important for determining whether you develop type 1. And it could be that you have type 1 diabetes, and therefore none of those traditional risk factors. Okay, next question. I noticed that around the area where I inject my insulin, my skin becomes red and blotchy. And sometimes, and so why is that? Well, people can react to the insulin injection in a couple of different ways. Sometimes just the irritation of the injection because of the needle can cause a little redness in that area. It's particularly true for people that reuse their needles, which we do not recommend, like using a fresh needle each time is important. If you inject in the same area too often, that can cause scar tissue and be a problem. So it's important if you inject insulin to keep moving to different sites. So that's another important tip. And on occasion, people can have allergic reactions. Usually the allergic reaction is not to the insulin itself, but it's to what the insulin is sort of packaged with, what it's diluted in. And so that's something to talk to your healthcare professional about, whether a different insulin would be beneficial. And then the last thing to say about this is people that are on insulin pumps, they have a catheter with something that sits like a needle that's or a catheter that sits under their skin and stays there for 2 to 3 days. They can get redness at that area also, and it's important that they don't leave it in longer because that's more likely to cause these problems. And that's why typically the recommendation is to change your pump site every 3 days. Some people can only go 2 days before it gets red and irritated, and so that's another thing to think about. And when you're seeing that irritation, the insulin may be absorbed differently, so it's a sign that you need to do something about it. Okay, we're moving right along here. Let's go to the next question. So here's a person that says, is a vegetarian diet good to follow? I've decided to stop eating meat, and I want to be sure that it will not affect my diabetes. Well, this opens up the whole area of nutrition and diabetes, and what you eat and what the best thing to eat is really a very personal decision and something that one size does not fit all. I would say for people that want to be vegetarian, which can be very good, it's important. One of the potential challenges to a vegetarian diet is making sure you get enough protein because vegetarian, a major source of protein is meat. You can definitely get protein through vegetarian foods. Beans, legumes are a great source. Certain grains, also a great source. So being mindful that you are getting enough protein. That's the biggest warning for people that are becoming vegetarian. That said, can you be a vegetarian and manage your diabetes effectively? Absolutely, absolutely. Um, and that brings this next question up that we hear a lot that relates to nutrition. And it says, I'm so frustrated. I don't know how many carbohydrates I need to have, and let it alone, are they too many? How many do I need? And you know, the reason this is challenging is there's no one answer. Uh, Different things for different people. So once again, it varies person to person, and what works well for you. And the best thing to do is to speak to your healthcare professional and ask to see a certified diabetes care and education specialist or a dietitian. The American Diabetes Association website lists where there might be one near you, so that can be a helpful resource. But the best thing is to sit down with a professional and go through that. And the reason I say that is that you know, the ideal meal plan for someone with diabetes should take into account a few different things. One, what do you like to eat? Because having you do something that is radically changing what you normally do, you may not stick to it. And really, when we're thinking about food and diabetes, it's not a sprint, it's a marathon. You're really looking to some kind of meal plan that you can be on long term. If you're only going to be on it a month, that's not really the right thing for you. So it's got to be something you like. And then it depends on what your goals are. Are you looking to lose weight, for example? Well, then coming up with a meal plan that'll help you lose weight. And there are many different meal plans that you can lose weight on. Some people lose weight on a high fat like a low fat diet, others are a low carbohydrate diet. What I often ask my patients is, have you ever been successful losing weight? And many of them have at some time, and then they rebounded back. And I say, well, what was it that you were doing that helped you lose weight? Because that may be a clue. So, what you like, what your goals are. Do you need to lose weight? Do you have heart disease? And there's certain meal plans that may be better for people with heart disease, like a Mediterranean diet. Uh, if if you don't have access to a dietitian, or a certified diabetes care and education specialist, what I recommend is on the American Diabetes Association website, diabetes.org, there's something called the plate method, and it sort of makes it easy and practical. And it gives you a number of different meal plans that can be healthy for you, and gives you an example of what a plate would look like. You know, what part of the plate would be meat and what part of the plate might be a starch, etc. So I recommend going there to get some advice on how to eat healthy with diabetes, because there's more than one way, and you want to find what's going to work for you and what you can do long term. Okay. Uh, Here's another question that has come up for our Center for Information. It says, the nurse always wipes away the first drop of blood from a finger prick. Is that necessary? And is that the correct way? And yeah, that is ideal when you're doing a finger stick. And the reason is a couple of things. One, to make sure that the blood is not tainted by any dirt or anything else that are on your fingers. And also, if you've used alcohol, which you should do before you do your finger prick, there might be a little alcohol left over and it might dilute the blood. So it's best to like skip that first drop and then take the next drop to put on a test strip if you're doing a finger stick. So uh, we've covered a lot of ground, and I mentioned at the beginning that this is my last Ask Dr. Bob here at the American Diabetes Association. don't worry, Ask Dr. Bob is going to continue, and you'll be seeing more information on how I'll be doing that. I mentioned that I'm leaving the American Diabetes Association after 4 years here as the Chief Scientific and Medical Officer. It's been such a privilege to serve in this role. So proud of what we've been able to accomplish in so many different ways to improve the lives of people with diabetes. And at this point in my life, it's a lot, and I frankly don't want to work quite so hard. So I'll be working part-time. I'll be continuing to do my work at Harvard Medical School, where I'm associate professor. I'll continue seeing patients at the Joslin Diabetes Center, and I'll be advising different organizations and people on how to deliver better diabetes care. And I will be continuing Ask Dr. Bob because I just enjoy this so much. This has been a wonderful 4-year journey since I've set this up. And so thank you all for being part of this journey with me. The best way to stay tuned to what's next in next month's episode is to follow me on LinkedIn. That's the social media platform I use the most. I know it may not be the most popular, but it's what I use. Connect with me on LinkedIn, and you'll be seeing where the next Ask Dr. Bob will be and how to connect. And I hope that you continue to follow me. I hope you find this helpful. I'll also have a way for you to send questions. And thank you, and thank the American Diabetes Association for giving me this opportunity to connect with you, and look forward to seeing you next month on the new Ask Dr. Bob. And so see you all then. Thank you.